I'm Chris Mortensen. You know, I've seen a lot of starting lineups. This one's impressive.
Anthony Fletcher, Georgetown University.
Fred Metters, Baylor College of Medicine.
Ali Krish, Emory University.
Kathleen Soteric, Duke University.
Lowry Barnes, Harvard.
Carlos Ramon, Tulane University.
Where do I practice?
Where do I practice? St. Vincent.
St. Vincent.
St. Vincent.
Nationally respected physicians here at St. Vincent and on your team.
St. Vincent. Inspired.
Well, it's a beautiful Friday, and on Fridays, St. Vincent sends one of the great docs around town in here, and Dr. Columbus Brown is here today. Good to see you, man.
Good to see you.
Yeah, a rheumatologist. You have your own practice. You're on staff at St. Vincent as well.
That's right.
Yeah, and arthritis is something that so many people deal with.
Definitely.
As you progress through life.
Definitely. Yeah.
And not even just old folks.
No, young people with osteoarthritis and rheumatoid arthritis, different arthritic conditions that I treat every day.
Very good. And well, we have some calls on the line. I figured that we probably would have some on there. And we'll go up first to Marie from Ward. Good morning, Marie. You're up first for Dr. Brown.
Good morning.
Good morning.
I had started having surgeries on a hand, and I had to wear a brace on it for 18 months, and we always thought the breakout in my hand was the brace. But since it came off, it still continued, and it went to other joints and rash in my hair. And I have been diagnosed with psoriatic arthritis because I had 8 surgeries, and I'd never had arthritis or breakouts like that before. And I've tried methotrexate and folic acid, and I'm still not healed.
Well, Marie, psoriatic arthritis is an inflammatory arthritic condition somewhat similar to rheumatoid arthritis. It can cause severe pain and swelling in several joints throughout the body. And the treatments that are initially used for it are anti-inflammatory medicines like Aleve and ibuprofen, and then you go on to stronger medicines that suppress the immune system like methotrexate. But for your case, since it seems to be spread in different joints, you might benefit from some of the newer medicines that work on the immune system and are either infusion medicines or medicines you give to yourself at home, like shots. And I found that they work very well with the arthritic condition and for the psoriasis itself.
So you might want to talk to your doctor about doing something like that.
Exactly, or have them refer you to a rheumatologist who who'd be more comfortable with treating that condition.
Very good, very good. Maria, I hope that helps you out. Next up, Ellie from Jacksonville. Good morning to you, Ellie.
Good morning. I've got several conditions, and what I was 42 and I'm now 59, and I was diagnosed back when I was 42 with osteoarthritis, osteoporosis, and degenerative joint and disc disease in my back. Now it's spreading down through my legs, and I'm having weakness in my legs, and I don't know where to go from here except to have a radical surgery. What do you have advice for me?
Well, Ellie, unfortunately, osteoarthritis occurring diffusely in the body is more common in women than men, and it sounds like you have what's called generalized osteoarthritis, basically meaning that it involves multiple joints throughout the body. And typically, you start out with anti-inflammatory medicines, like I mentioned, with psoriatic arthritis, but if that doesn't control it, then you have to move on to stronger medicines. But if in one or two particular joints where you have bone-on-bone osteoarthritis, then surgery usually is an intervention that's necessary. But if it's in your back, like degenerative disc disease is essentially the same thing, then sometimes steroid injections help out. You get sent to a specialist who does that, or some types of physical therapy help out. But a lot of people eventually require surgery on their back to kind of control the pain and weakness that it can cause.
Is that very effective, the surgeries, most of the time?
It depends on what is going on and what kind of surgery you get. If there's a disc that's pushing on a nerve or the spinal cord. If you take out the disc, then it can relieve that pain and weakness that occurs in the legs. But it just varies from patient to patient.
Right. So, Ellie, it may be necessary, and it may be very helpful too, but you'll have to talk to your physician about that. Dr. Brown, thank you so much for being here. Here's the information. If you'd like to get in touch with him, Dr. Columbus Brown is on 8907 Canis Road, 217-9382. There are his office hours, also on staff at St. Vincent. And we want to thank St. Vincent for bringing in Dr. Brown to visit with us today. Very informative, and I hope it helped you out. All right. Take care and come back and see us.
Thank you.
All right.